What pigmentation laser treatment should I choose? When it comes to tackling pigmentation issues with laser treatments, it can feel overwhelming with so many options available. The right choice really depends on your specific skin type, the depth and type of pigmentation you want to treat, and your overall goals. From a plastic surgery perspective, laser therapies are a safe and effective non-surgical way to improve skin tone and clarity when used correctly. First, it's important to understand the kind of pigmentation you're dealing with. Superficial or surface-level pigmentation, like sunspots or freckles, responds well to lasers with shorter wavelengths. These include Q-switched ruby lasers at 690 for nanometers or frequency doubled end, YAG lasers at 532 nanometers. These lasers target melanin in the upper skin layers and usually requiring a few sessions spaced about 4 to 6 weeks apart. The cost can range from around $100 to $500 per session, and most people see noticeable improvement after 3 to 5 treatments. For deeper pigmentation, such as age spots or melasma that affects the dermis, longer wavelength lasers are more appropriate. The Q-switched end, YAG laser at 1060 for nanometers penetrates deeper into the skin and is safer for darker skin tones, reducing the risk of post-inflammatory hyperpigmentation. These treatments typically also need multiple sessions, but they are more effective for stubborn or deep-seated pigmentation. Laser types vary, and each has its strengths. Q-switched lasers are considered the gold standard for pigmented lesions because they deliver short, high-energy pulses that break down melanin into smaller particles that your body can naturally eliminate. Fractional lasers create tiny zones of controlled injury in the skin, which stimulates collagen production and improves overall skin texture and tone, making them good options for broader skin rejuvenation. Picosecond lasers like the Picosure are newer and work by shattering pigment into even smaller pieces with less heat, reducing side effects and making treatments more comfortable. Intense pulsed light therapy is another option. It uses broad-spectrum light rather than a single wavelength, making it effective for superficial pigmentation like sunspots and freckles, especially in lighter skin types. However, it's less effective for deep pigmentation and is usually combined with other treatments for best results. Ablative lasers, such as carbon dioxide or erbium lasers, remove outer layers of skin and stimulate collagen, but they carry higher risks and longer recovery times. These are typically reserved for severe sun damage or scars rather than isolated pigmentation issues. Your skin type plays a big role in choosing the right laser. Darker skin tones, classified as Fitzpatrick types 4 through 6, are more prone to post-inflammatory hyperpigmentation. For these skin types, lasers with longer wavelengths like the 1060 for nanometer end, YAG are safer because they minimize risks. It's crucial to have treatments performed by experienced practitioners who can adjust settings carefully to avoid adverse effects, such as hypopigmentation or worsening pigmentation. Sometimes, combination treatments are used. For example, pairing IPL with fractional lasers can target both superficial pigment and improve skin texture, giving a more comprehensive rejuvenation. These combined protocols are often tailored to complex cases like melasma, which can be challenging to treat. The number of sessions needed varies, but most patients requiring at least 3 to 6 treatments spaced 4 to 6 weeks apart. It's important to understand that results depend on your individual skin and pigmentation type. Post-treatment, protecting your skin from the sun with broad-spectrum sunscreen is essential to prevent recurrence and maintain your improvements. In summary, choosing the right pigmentation laser treatment involves understanding your skin type, the depth of pigmentation, and your goals. For superficial spots, Q-switched lasers are highly effective. For deeper or stubborn pigmentation, longer wavelength lasers like the end, YAG 1060 for nanometers are safer and more effective, especially for darker skin tones. Fractional and picosecond lasers offer additional benefits for skin rejuvenation and pigment removal with minimal downtime. Always consult a qualified plastic surgeon or dermatologist experienced in laser therapies to develop a personalized plan that is safe and effective for your unique needs.